So, go ahead, ma'am.
Hello everyone, this is Dr. Hema Vaithianathan from Oasis Fertility, Chennai. So in this session, let's understand more about the common problem that women faces, the menstrual cycle issues. And let's also understand if these menstrual cycle problems can lead to fertility problems in women. So let's understand this in this live topic. To start with, the common problem in women is menstrual cycle abnormalities. But not all menstrual problems are the same. So there can be different symptoms related to menstrual cycles that a woman can experience. For example, the problem in menstrual cycle can be based on the menstrual cycle length, or it can be based on the cycle flow, or sometimes it can be based on the premenstrual symptoms, and sometimes it can be other type of menstrual problems like intermenstrual spotting between periods. So let's clearly understand what are the different types of menstrual problems that a woman can experience. So the first and foremost, the most common complaint related to menstrual cycle is irregular period. But women has to understand what is the true definition of irregular period, and when do we call as irregular period when a woman complain of cycle irregularity. Irregular periods can be a symptom of an underlying gynecological problem. And the most common underlying problem is polycystic ovarian syndrome. So many women with PCOS present with menstrual cycle abnormalities and most commonly irregular menstrual cycle. So irregular cycle is when there is cycle duration which happens above and beyond like 35 days of the menstrual cycle, and but this irregularity cannot be taken into consideration for adolescent girls, because adolescent girls in the initial 2 to 3 years after their first period, the cycle can be irregular, and hence the definition, or how do we the diagnose irregular period in adolescent age group in girls is different than adult women who is like more than 3 years beyond their first period menstrual cycle. Irregular period is the most common symptom, or the unpredictable period, or the cycle going longer than 35 days or shorter than 21 days is the common problem that we see. And also missed periods, also known as amenorrhea, is the next common complaint regarding the menstrual cycle. And also with respect to the menstrual cycle flow, the flow of menstrual period can be heavy or it can be scanty. So both can be a problem, but most women present with the heavy menstrual flow problem, also known as a heavy menstrual bleeding. So all these menstrual symptoms are usually, as the name says, it's only symptoms. The treating the symptom is not going to cure the underlying problem. So whenever there is menstrual cycle problem, we need to run a certain test and do some examination and identify the underlying gynecological problem that is causing the symptom. Only then the symptom can improve in a woman. So the other common complaint is light periods or very scanty periods, that is related to the flow of blood in the menstrual cycle. And also many women can experience what is intermenstrual bleeding, that is bleeding happening in between the two menstrual cycles. There can be slight spotting or bleeding that happening in between two fixed menstrual cycles. So that is called an intermenstrual bleeding. There can be different set of problems that can be causing this intermenstrual bleeding as an issue. And also some women may not fall into any typical menstrual cycle problem. There can be inconsistent flow patterns, there can be unpredictable and irregular menstrual cycles, and with varying levels of blood loss. So symptoms related to menstrual cycles can be different in women, and it will be very helpful if they mention what is known as a menstrual diary and note down their onset of periods, note down their duration of the flow and the amount of blood flow they experience and the associated symptoms, if any, they're experiencing. Like some women can experience severe menstrual cycle pain, dysmenorrhea, and also sometimes there can be severe premenstrual symptoms. That is, before even they start their menstrual cycle period flow, they may experience some premenstrual symptoms in the form of mood changes, breast pain, and some women can have a headache and weight gain and mood disturbances. So premenstrual symptoms is also a type of menstrual problem. as I mentioned, the mood swings, breast pain, bloating, and irritability can be related to the period, related to the hormonal fluctuations that happens in period cycle. And these menstrual problems also can lead to difficulty in conception and fertility issues. And so this is one of the recommendations, that is international recommendation that I have quoted here to understand about irregular cycles. So irregular cycles, the underlying problem is ovulatory dysfunction, which means that the woman is not regularly ovulating, that is, she's not releasing an mature egg from the ovary in that cycle. So if that cyclical ovulation is not happening, then the periods also get irregular. So irregular cycles is the problem. Is a problem that shows there is an underlying anovulation or the ovulation related issue. So we cannot call if the woman is having a cycle anywhere between 33, 34 cycles length, then it cannot be called irregular menstrual cycles. So to define irregular menstrual cycles, the cycle duration has to be beyond 35 days or under 21 days in a woman who is more than 3 years since her first period. So if in adolescent girls who are less than 3 years before their first menstrual cycle, even beyond up to 45 days, if the cycle is okay, beyond 45 days, we call it as irregular cycle. And also you can calculate like how many number of menstrual cycles you usually get. Any cycle which is less than 8 menstrual cycle in 1 year can be called as an irregular cycle. So irregular cycles, it is important, as I mentioned, maintain a menstrual diary or use some applications in your mobile phones to note down or track your symptoms and track your menstrual cycle parameters and bring it to your gynecologist to understand better your menstrual cycle and make a proper examination and diagnosis. So some of the concerns with irregular cycles is, so changes in your menstrual cycle pattern, it should persist for several cycles. Also, because menstrual cycle can get disturbed because of any short-term problems in women, like even stress or any changes in your body weight, or if you make any changes in your regular diet pattern, it can bring about menstrual cycle disturbances temporarily, like 1 or 2 cycles may get disturbed. But if it persists for several cycles or beyond like 3 cycles, then it may need it needs investigating. But a small temporary disturbances in menstrual cycle can be normal. So always look for changes in your menstrual pattern that is persisting for several cycles. As menstrual cycle, as I mentioned, can be disturbed by any transient acute stress or any changes in your diet pattern and changes in your body weight. And also, if there is absence of menstruation 3 or more consecutive months, unless it is due to pregnancy or because you have attained menopause, then it really requires evaluation because there can be a lot of underlying hormonal disturbances that can cause this type of absent periods or amenorrhea. Most likely, it could be because of thyroid problems or the prolactin. What is the high levels of prolactin in your blood also can cause this kind of absence of menstrual cycles. And also if you experience severe pain in your period or unusually heavy bleeding, and especially if you're passing large blood clots, it is a symptom that there could be some underlying gynecological problem that is causing this. And irregular bleeding, any spotting between periods is a concern that needs to be examined and the underlying problem identified. And especially if it affects your daily life and also it results in some fatigue and it needs evaluation and treatment. So so those are the symptoms so far we have been talking about. The symptom of irregular menstrual cycle, the symptom of absent cycle, the symptom of dysmenorrhea or severe period-related pain. Let's understand something about the underlying causes. What could be the reason women will have menstrual cycle that are persistent? And the most common condition recently that we are seeing is the polycystic ovary syndrome, and the main classical symptom that a woman presents with is irregular menstrual cycles, also known as oligomenorrhea. Next is thyroid conditions. So many women are these days having thyroid disturbances, especially both underactive thyroid gland or even if you have overactive thyroid gland. Both can disturb the hormone balance and can result in period abnormality. Also, severe stress can cause this tilt in the hormone balance and can disrupt your menstrual cycle. Any lifestyle factors, because if your body weight is one important factor that you have to maintain in order to have regular menstrual cycles. Any tilt in the balance, and if there is any abrupt weight loss, there is any abrupt weight gain, both can affect the menstrual cycle regularity. And also if the woman involves in an acute, in a short period of time, if she is involving in an excessive exercises and crash dieting or any restrictive dieting or any diet where the diet is not very nutritionally balanced, can all this bring about menstrual cycle problems. So any diet which is not balanced and poorly nourishing you can also lead to menstrual cycle problems. And also any background if the women has chronic problems in the body, like any factors that is not related to your ovary or uterus, even chronic underlying problem in the body can also affect the general health as well as it can affect your menstrual cycle irregularity. And these are some of the causes, and there are other causes, specific gynecological problems causing menstrual cycle irregularities like polycystic ovary syndrome, as I mentioned, and any women who is reaching to the menopausal stage, the perimenopausal period, that is around the time of attaining menopause, can have irregularities to the transitional phase. What is known as the perimenopausal time can bring about period disturbances. And also stress, high levels of stress, anxiety, and emotional disturbances can disrupt the hormone balance and cause period problems. Both underactive or overactive thyroid issues also can affect the regularity of menstrual cycles. So those are the causes of can cause menstrual problems, and out of which all of the conditions, almost all of the conditions that disrupt menstrual cycle can also affect the ability to conceive, also can bring fertility problems and infertility. So hence, if a woman is attempting conception and she is experiencing menstrual cycle problems, it is important that a proper examination and proper evaluation is made to correct an underlying condition in order to optimize your fertility. So what are the diagnostic tests that are available for women experiencing menstrual cycle problems? So initial will be your history should be thoroughly assessed. We have to understand your menstrual cycle problem and also your associated symptoms. Your complete thorough history is important for us to understand and channelize and plan the type of testing that you will need. And also there should be a proper gynecological examination. And there we will have to run a blood test, especially blood test to check for your hormone levels in the body. Most commonly, as I mentioned, hormonal imbalances is one of the reason that is tilting this irregularity of menstrual cycles. So always it is important that thyroid problems are ruled out, and other hormones that are usually assessed or estrogen levels, progesterone levels, prolactin levels, and other hormones related to the irregularity of menstrual cycle like FSH and LH initially to understand the underlying problem. And also, most important other test is to have a pelvic ultrasound to identify the health of the uterus and identify the health of the ovary. Most commonly, to identify the presence of polycystic ovaries, the ovary, it is important that we have to do a pelvic ultrasound to properly identify this ovarian morphology. Other testing is known as endometrial biopsy. If the woman is having very heavy menstrual bleeding and is persistent even after medical treatment, and if the ultrasound shows that the inner lining of the uterus, the endometrium, if it is thick, it is important that endometrial biopsy should be done to identify if there is no other hormone-related pathology in the endometrium that needs to be addressed. And those are some of the basic testing, which includes history, examination, specific blood testing, and ultrasound to identify the general health as well as the problem. Those were the testing that we discussed. And next, about the treatment options. Majority of the treatment options will be planned only after making the proper underlying diagnosis that is causing the issue. And and also even before an evaluation, sometimes symptomatic treatment can be done to regularize your cycles, to control your menstrual cycle pain. Always symptomatic treatment can be started at any time. After identifying any underlying problem, the specific treatment can start. And some of the treatments that you can expect to have is to sometimes oral contraceptive pills will be prescribed, especially if the woman is having irregular period because of polycystic ovary syndrome and she is not attempting to conceive at that time. OCP is an option to regulate your menstrual cycles. And also medications are available to reduce the menstrual cycle related pain, and also medications are available to control the amount of bleeding in your menstrual cycle so that there is you don't develop anemia or the reduction in the hemoglobin. Also, if the hemoglobin is low, you will have to be put on iron supplements to improve your hemoglobin and improve your anemia related symptoms. And also, in with whatever be the condition, you will be advised to adopt a healthy lifestyle. A healthy lifestyle involving taking some kind of physical activity, regular exercises, and balancing your stress management and maintaining your mental health is the priority to regulate your menstrual cycle. So always follow some kind of relaxation techniques and manage your stress in order to optimize or regularize your menstrual cycle. So also the most important thing that I want to stress is taking a healthy balanced diet to maintain your ideal body weight. So healthy balanced diet is important to control your body weight because both underweight problem or overweight or obesity both can bring abnormality in your menstrual cycles. So managing and maintaining an optimal blood body weight is important by adopting a healthy lifestyle to regulate your menstrual cycles. So if not the modifications or some of the initial medications and hormonal medications, if they are not helping, or if the problems, the symptoms, there is no improvement in your symptoms, then specific other second line or third line options will be undertaken. Some of it are surgical interventions to correct, if there is an endometrial polyp or fibroid that is causing this menstrual symptom, then that has to be removed, and a surgical intervention sometimes can be necessary if the woman has this kind of underlying problem, which is endometrial polyp or fibroids or any other physical abnormality in the uterus or ovaries. And sometimes if the woman has fertility issues and she's attempting to conceive and infertility is the problem, then the type of management is different and she'll be given medications to correct her ovulation. Certain type of medications known as ovulation induction treatment can help to restore your ovulation, to improve the chances of conception. Also, based on the underlying problem, based on the underlying severity, various levels of fertility treatment can be advised from ovulation induction to intrauterine insemination in patients with endometriosis or patients with unexplained infertility. And also sometimes the in vitro fertilization or IVF can be necessary depending on the underlying causes that is causing problems. And whatever it is, whatever the underlying problem that is causing, like as I mentioned, the most common reason being PCOS and thyroid problems, the underlying problem has to be corrected. So, for example, if it is thyroid issue, you will be put on replacement doses of thyroxine medicine in order to control your menstrual cycle and to bring back the regularity. So, at the bottom line, I want to stress the fact that menstrual cycle abnormality itself is not a disease; it's only a symptom. So, treating your symptom, that is controlling your pain or controlling the menstrual blood flow, is definitely not the treatment. So, the treatment when you have a menstrual cycle problem is giving you a thorough evaluation in order to identify the underlying problem and then focusing the treatment based on the underlying problem. I hope it helped you understand about menstrual cycle irregularities and fertility issues, and I thank you all for your attention. Thank you.